Hi, my name is Joseph Mayer, and today I'd like to talk to you about concussions. What causes a concussion? Well, concussion is a type of traumatic brain injury that is caused by a bump or a blow to the head, causing the head and brain to move back and forth. This may cause the brain to bounce or twist in the skull. And this can happen through head to head contact, head to ground contact, or object to head contact. While we find that any sport can have a concussion occur, baseball you might see a pitcher hit a batter in the head on accident. Line drive may be hit back to the pitcher, and a concussion can occur that way. But typically we see that contact sports are where concussions are more prevalent. So in high school, male sports that receive the most amount of concussions are football and hockey. Female sports is soccer. So most of this happens with player-to-player contact. So things through legal play. You see the two pictures here on the side. A typical tackle. The defender may not have the best form there, but that's legal play there, player-to-player contact. And then the girls playing soccer there, it's a legal play. They're both going to head the ball, but they potentially are making contact with each other's head, and that can cause concussion. So those are legal plays, but 25% do come from illegal plays. So anything that could potentially, create a foul or draw a penalty. So in football, that would be, hitting a defenseless player, targeting with the head, things like that. And then in soccer, potentially a high kick where a foot is makes contact with another player above the waist. So it could, somebody could get kicked in the head with a cleat. So there are 1.6 to 3.8 million sports-related TBIs reported each year. And sports-related TBIs are only second to vehicle accident TBIs, and that typically occurs in the most competitive range, so your 15 to 24-year-old group. While all sports have the potential to receive a concussion, or all athletes in each sport could receive a concussion, it's more prevalent in your contact sports, and then American tackle football has a high prevalence of it. In the NFL, it's reported that there are 6.58 concussions per game, so one every other game or so. And Clark and colleagues recorded the injuries between 2010 and 2014 to be able to come up with that statistic. So we are getting better. As you can see the numbers below there, we have previously in about a 54-year span, we had 497 deaths come from brain injuries. 266 permanent brain damage and spinal injuries were reported between 77 and 98, so an 11-year span there. And then between 65 and 74, there were 167 brain injury deaths. Concussions in the college level account for 7.4% of all injuries. And there are 8.1 injuries per 1,000 athlete exposures. So that's pretty much your point 0.56, 0.6, somewhere in there. So pretty typical to the NFL, similar at least. High school is the same, zero point 0.6 per 1,000 athlete exposures, and that includes practices, games, preseason, regular season, postseason. So some of the symptoms of a concussion, so PCS, post-concussion syndrome, you will have a headache, you'll be dizzy, nauseous, possibly vomit, you'll have sensitivity to light, sensitivity to sound, ear ringing, difficulty focusing, so that'd just be your vision. You'll have postural lightheadedness. You'll have some loss of smell, and possibly fatigue. So all these are possible. Not every one is going to occur, but all of these are listed as symptoms and could mean that a concussion is there. And then you have your cognitive, which is mental fogginess, difficulty remembering things, difficulty concentrating, and then difficulty finding words. And then you might have some behavioral issues that arise, irritability, anxiety, insomnia, and depression. And especially in those long-term PCS cases, you see it a lot in professional football athletes, that they have that depression and irritability down the road. So those are all some things that you can look out for. So how do we respond and how do we treat? Well, as soon as you believe that a concussion has occurred, the first thing you should do is remove the athlete from play. That way you're at least going through and making sure that the athlete is protected, even if it's an important part of the game, an important game, a championship. I mean, nothing is more important than a person's mind and future in their life. So we need to check for life-threatening injuries. So if there's like a blockage of airway, anything that could create additional problems, we want to check for those first. And one good way to assess for a concussion is the sports concussion assessment tool. And it's a good way to identify head trauma in athletes. And it goes through questions and tests. So you have your memory assessment, symptoms assessment like your headaches and vomiting, cognitive assessment, so your memory, balance assessment, and then neurological assessment. Treating it, first thing you should do is you have at least a 24-hour period where you are relaxed physically and you have cognitive rest. So physical rest is important because any jarring can have a reoccurrence of a concussion, or a second concussion can occur. And then your cognitive rest is important because you need to relax your mind, relax the stimulus to the brain so that your brain has a chance to recover fully. And again, that should be at least the first 24-hour period. If headaches do occur, then it can be treated with acetaminophen. There is a return to play protocol. Each one of these stages is a 24-hour period. So after your initial 24-hour period of physical and cognitive rest, if you have no symptoms of the concussion, or you're asymptomatic, then you can begin light aerobic exercise. That can happen for the next 24-hour period. Again, if you're asymptomatic, then you can move on to the next step. Next step would be your sports-specific exercise, followed by non-contact exercise, then full contact exercise. And as long as you are asymptomatic through all those steps, then you should be able to be released to play. So the cranial nerves that are potentially affected, you have your olfactory, which is your smell. So if there is impairment to any of these nerves, then there is a potential impact on, specifically for the olfactory, your smell. So if you can't smell things as good as you used to, and it can affect your taste because those are tied together. You have your optic nerve, which affects your vision. So on the vision, that would be like finger counting, so holding your fingers up and having somebody count how many fingers you have. So your ocular motor, that's your eye movement and pupil size, and that's done through like light reflexes and checking to see if the pupil responds. Your trochlear, which is your eye movement, and so you can see this through either like a droopy eyelid or protrusion of the eyeball. You have your trigemial, so touch to face and mastication muscles. So there would be like a complaint of pain while chewing. Your abducens, which is your movement of the eye, so you check that through your corneal reflexes. Facial expression, or your facial nerve, which is your expression muscles, and your taste. Your anterior two-thirds, which is the anterior two-thirds of your tongue. You can have poor eye closure, is one way to test for that. Auditory or vestibular, which is your hearing and balance, so you can check the ear for bleeding. Glossopharyngeal, so throat muscles, salivary glands, taste, which is the posterior one-third, and then your blood pressure, that can be checked just through hearing tests. The vagus, which is heart, lungs, abdominal. So you can listen if they have a hoarse voice or they have an inability to cough. spinal accessory, so your throat and neck muscles, and that's if you have a difficulty swallowing, is one way to assess if there's an issue with that nerve. And then your hypoglossal, there's a difficulty articulating words, which seems like I'm having right now. But through this, it's important that you check all of these things to check the severity of the concussion or of a potential concussion. There is GCS, which is the Glasgow Coma Scale, and it's commonly used to assess the severity of a brain injury, and it has 3 levels. So you check the nerves for the concussion. The GCS scoring system is rated from mild or minor, and that's if you score 13 to 15 on the scale. And so a higher score, 15 being the max, a higher score means less severity of the concussion. While that 13 to 15 range is minor, 9 to 12 range would be moderate, and then anything less than 9 is severe, and a severe rating has a mortality rate of 40%. So it's very important to check these things early. As soon as we feel that concussion has occurred, we want to check these things across the baseline of what we know about the athlete, and then we want to check down the road, a little bit down the road, maybe 15 minutes, 20 minutes, to make sure that there isn't any worsening of these symptoms or issues that may be affected by these cranial nerves. So here are some references. And thank you for listening.